Good morning, everyone. My name is Dr. Amit Chaudhari. I work with Human Society International, and today I'm presenting our programs from Philippines. So just going through the rabies situation in Philippines. Philippines is one of the top 10 country in terms of human rabies cases. A total 1,176 human cases have been reported since 2014 to June 2018, with an average of 258 cases every year. These are data from Department of Health, Philippines government. The program we are working in Philippines are in two cities. One is Quezon City, which is part of Metro Manila, and another is Cebu City, which is a part of Cebu Island. So we working in Philippines for enhancing veterinary capacity by providing spay-neuter training program. But when we came to know that they have a rabies situation, we also tried to look into the situation. We saw that there are continuous number of rabies cases reported in both human and animal sector. Also same in Cebu City, they have a human and animal cases reported every year. So first question was, are they doing any program in Philippines in terms of vaccinating dogs or not? They said yes, they are vaccinating. So we got some data from them. So in Cebu City, they're annually vaccinating around 20 to 30,000 dogs, depending on the vaccine and the capacity of Department of Livestock. So we asked why you're vaccinating this number specifically. So they told us that they assume there are 10 dogs per 100 human. And some of the people go to private veterinary practitioner for vaccination, and there are some people who can't afford. For them, city government, veterinary department provide a vaccination booth at a central location, and people bring their dogs for vaccination. So this was the scenario from many years, and with this, they were unable to fix rabies situation. Same with the Quezon City, District 2. They also take the same number, 10 dogs per 100 human, and they also believe that most people go to private practitioner for vaccination, and people who can't afford, for them, they also provide centrally located vaccination points, and they were also vaccinating around 20,000 dogs annually. So with this, we asked them that, is there something we can do? Either your vaccine quality is not proper, is the number you are vaccinating is not enough, or what is the problem? So they said they got OIE approved vaccine, Mariel, and they don't have any problem with vaccine. So must be the dog population they are referring is not correct. So we did a big workshop with the Bureau of Animal Industry, Department of Veterinary Cebu City and HSI together did a workshop for dog population survey in 2017. We trained them how to collect household dog data. We use mobile application, OSM tracker and EpiCollect 5. And we collected data from house to house based on the methodology we developed for cities. And the results were interesting that in Cebu City we found there are 17.7 dogs, where they were estimating there are 10 dogs per 100 human. Out of 17.7 dogs, 43% were allowed to roam unconfined at some point of the time in a day. In Quezon City, District 2, we also found that 21.6 dogs per 100 human, where they were under impression there are 10 dogs. So we produced big number for Cebu City, 135,000 dogs. For Quezon City, we said 150,000 dogs, which was unacceptable for them, because if they target this population, they are short in vaccine. So they don't have enough vaccine if they believe these numbers are right. So they said this number can't be true, because we don't see that there's many dogs. So we went step ahead. We said, okay, let's do program together and find out how many dogs we can vaccinate. So we did some preparation planning. We hired new vaccinators. We brought some required stuff. We got support from veterinary department. We got support from the politicians or the city administrative department. We made a big team, and we started vaccinating door to door by using the mobile phone application to make sure that in specific area we are covering number of dogs required to cover. So we able to see which area we are covering on a Google map. We make sure that there is no economically slammed area remain uncovered because those are the area where mostly the rabies cases often show up. And in a first attempt, we were able to vaccinate 3 times higher than what they used to vaccinate. So their average was around 20, 30,000, and in the first attempt in Cebu City, we vaccinated 97,000 dogs. Same happened with the Quezon City, District 2, where they used to vaccinate 26 or 27,000 dogs. We vaccinated 98,000 dogs. We're supposed to vaccinate more than this, but by this time, we run out of the complete 2 years quota of vaccine they were having. So they run out of all the vaccine they were having. Now it's time came that they realized that there are more dogs, and that's why there was a problem, and they were unable to fix the problem. So they believe that there are many dogs, and there are still more to vaccinate. So just an approach that making sure that what we are doing might be not enough in terms of the results we are expecting. So a way forward and making programs sustainable is the next step, that now we know that there are more dogs, and we were under vaccinating from years. So the failure was because the program implementation and sometimes vaccine quality is not good. Unknown dog population, that we don't know how many dogs are there, and we are just doing with the capacity we have. So most rabies programs are in a way that we have few vehicles and few people, and we have X number of vaccine, so we can do X number of vaccination. That is how they designed the program. It's supposed to be opposite way, that what is the population, how you should reach 70 or 80% of the population, and then you have to make sure that you have number of logistics arrangement accordingly. Lack of veterinary and human health collaboration. So most often the veterinary department and human health departments are not in the same line. Lack of technology and support and surveillance. So mostly the centrally located vaccination efforts means this vaccination effort rely on people's wish to come and get their pet vaccinated. Rather, we preferred going door to door and vaccinate, or making compulsory for people to get their pet vaccinated. So that's what we did. We find out what dog population is and target more than 70% dogs. A joint effort by human and veterinary sector, use of technology and program, and establishing effective surveillance. For long run, mostly after a couple of years, the government realized that this can't be run through many years, because rabies is not something which you do a year or two and you will be fixed for forever. So government should be on board from beginning, that they are aware that this program will take longer than a year or two, and the same effort and same amount of money will require to make sure that there are no rabies cases happening. Community engagement and education is very also important, that people are aware what you are doing, why you're doing, and mostly the children who are target for rabies cases should know what to do if they get bitten. So long-term resource identification and annual large-scale vaccination events make it possible. Yeah, that's it. So rabies is one of the few communicable diseases which can be controlled by currently available tools. So it's not impossible. Thank you.